Good afternoon. We'll now start. So first of all, I'd like to welcome everybody to this pep talk. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk, so please show your faces in the video. As a reminder, please take the online learning evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate. The link is already in the chat box. As another reminder, is that 50 OLETE certificate entitled one to a voucher for a free ROJoson telemedical consultation. Another request that I'd like to make is that those who are not planning to take the OLETE, where I ask for a feedback to my pep talk, please type in your feedback in the chat box during the open forum and before we part ways. So let's now have a group picture taking before we start in 2 minutes. Please show your video now. Turn on your video and show your face. Okay. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I will be I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on the enthusiasm of the participants. My pep talk today is entitled Fundamentals and Generalities in Pain Management. The empowerment objective is for the lay people to have an understanding of the fundamentals and generalities in pain management. I'll be talking about more common causes of pain and also the general concept of pain itself. Definition of terms in the title: fundamentals to mean the basic principles, foundation, and the basis. Generalities, majority, not all, not detailed, not specific, as I won't be able to cover everything. Pain management means how physicians usually manage pain in the patient, or how you will be managing your own pain if you had one. The contents of this pep talk will be the following: what is pain? What are the different types of pain? There are so many types of pain. And what are the principles, fundamentals, generalities of the management of the different types of pain? I will just include the commonly encountered pains in life. So what is pain? Pain is an unpleasant sensory, when you say sensory, it's physical, or emotional, or mental experience in the person. So it's unpleasant. Okay? Pain is always a personal experience that is influenced to varying degrees by biological, meaning the physical makeup of the person, psychological, mental, and social factors. So through their life experiences, individuals or all persons learn the concept of pain. So when a person reports of an experience as pain, it should be respected. So whatever terms used by patients to connote or by any people, any person to connote pain would be accepted as pain. So some would use the word ache, some would use the word pain itself, and then some would use numbness. Numbness is also a type of an unpleasant sensory experience. Okay. Then masakit, makirot, mahapdi, manhid, and others. There are a lot of terms that are used to connote pain. There are so many ways of categorizing the types of pain. So first of all, we start with the general types, two general types, physical pain and mental or emotional pain. Now, physical pain is usually accompanied by mental pain because of anxiety, because of the pain itself. So we call this compounded physical and emotional pain. Now, the other type of pain, which is the mental pain, okay, usually by itself, it causes pain already, but a lot of times it can also be accompanied by physical pain. So mental pain can produce physical pain. So this is what we call psychogenic pain. Now, in the compounded physical and emotional pain, the focus of management would be the control of the physical pain so that the emotional aspect of the pain will just get dissolved or resolved or disappeared. Now, for emotional pain, if it's accompanied by the physical pain because of the so-called psychogenic pain, the main focus of management is the control of the psychogenic pain or the emotional pain because it's the one really causing the focus of management will be the control of the emotional pain because this is the one that causes the physical pain. Another way of categorizing pain will be the following: the so-called nociceptive pain and the neuropathic pain. Okay. Nociceptive pain usually caused by damage or potential damage to body tissues and not working properly. So you usually experience sharp, aching, throbbing pain. Whereas neuropathic pain are those caused by damage or potential damage to nerves, yung mga ugat, no? or nervous systems, or not working properly so that you have shooting, burning, numbness, tingling sensations. So sometimes you can have combination of the two, combined nociceptive and neuropathic pain. So the difference between the two is that aside from the type of damage to the body, okay, usually nociceptive pain responds to outside stimulus. Okay. Example, somebody hit you, you have pain on the area that was hit. Whereas neuropathic pain, usually it's not in response to outside stimuli. It's coming from inside, it's from the nerve itself. Nociceptive pain usually acute, okay, yung biglaan, okay, that usually sandali lang, okay. Sandali can be in 1 minute, 2 minutes, or sometimes in terms of days, but not in terms of months. Okay. Neuropathic pain usually chronic, yung matagalan, yung paulit-ulit. Okay. Examples of nociceptive pain will be burns or sunog, sprain, fracture, inflammation, infection. Examples of neuropathic pain caused by nerve, you have sciatica on the legs, cramps, muscle carpal tunnel, neuralgia, okay, pain on the nerve, and diabetic neuropathy. Now, there's such thing as spontaneous pain. Spontaneous pain is defined as occurring without any apparent external cause or trigger. Biglaan na lang, sudden, but it's usually transient and short-lived, sandali lang, okay? Depending on the quality of pain felt, it may be nociceptive or neuropathic. Now, if one have a spontaneous pain that is characterized by shooting, burning, stabbing, or electric shock-like pain, like tingling, numbness, or a pin and needles feeling, then you call that a neuropathic spontaneous pain. Now, another classification of pain, the type of nociceptive pain, there are two types, general types, somatic and visceral. Somatic nociceptive pain is one which originates in your arms, in your legs, face, muscle, tendons, and superficial areas of your body. So it's practically outside the internal organs, okay? Whereas visceral pain usually originates from your internal organs. Example, if you have stomach pain, it's called a visceral pain, or pain from a kidney stone, pain from a gallbladder stone, it's called visceral pain. Somatic pain, nasa labas, sa muscle, sa outer layer of the body. Now, the different types of neuropathic pain, you have motor neuropathy. So this is the, you have damage to the nerves that control the muscles and the movement in the body, such as moving your hands on your arms or talking. And sensory neuropathy, damage to the sensory nerves that control what you feel, such as pain, temperature, or light touch, the sensation. Automatic nerve neuropathy, another type of pain, damage to nerves that you are not conscious of, such as when you have pain in breathing, pain in your heartbeat, when you have heartbeat accompanied by pain. Mental or emotional pain, this originates from non-physical sources, in contrast to physical pain coming from outside sources. So it may be a result of action of other people, yung stress that you have with other people, it causes mental pain, or it goes with your personal feeling of emotional pain. When you feel some regrets over something, then if you have a grief or loss of a loved one or any important objects, so you can have this type of emotional pain. Psychogenic pain is a pain disorder associated with psychological factors. Some types of mental or emotional problems can cause, increase, or prolong the pain. A person with a psychogenic pain disorder may complain of pain that does not match their symptoms. So the question is, can psychological problems cause physical pain? It starts with psychological problems and then lumalabas yung physical pain. So pwede. Okay? So if the patient is experiencing unexplained aches and pains, it may be linked to the mental health. Kung yung doctor hindi niya ma-explain, bakit may pain ito? Bakit may mga pain in this and that areas? And iisipin na lang niya, baka there's something wrong with the mental health. Okay, so people with mental illnesses can experience a range of physical symptoms such as muscle tension, pain, headaches, so insomnia, and feelings of restlessness. So these are the common symptoms that are considered that usually fall under psychogenic. But of course, this can be caused by physical pain also. Chronic psychogenic pain can be felt all over the body with varying intensity, though it most commonly presents as headache, muscle ache, abdominal pain, and back pain. Again, psychogenic pain can cause headache, muscle ache, abdominal pain, and back pain. Aside from yung mga tension, yung mga headache secondary to a tumor, okay? Muscle ache because of some trauma. So these are examples of those caused by physical factors. The other categorization of types of pain will be whether the pain is acute or chronic. So when you say acute pain, it resolves spontaneously or quickly, okay, right away. And chronic persistent pain will be one that lasts for a long time. So when you say lasting for a long time, many authors have different definitions. When you say chronic, some would say it's longer than 30 days, 1 month. Okay. Some would say that it's longer than 3 to 6 months. Iba-iba yung criteria for this chronic pain. When you say acute naman, it's less than 30 days. Basta before 3 to 6 months. That's another way of classifying it. So if you have pain less than 30 days, it's usually acute. If it's longer than 30 days, usually chronic ang categorization. Pain may be of different intensity at any point in time, so you can quantify the degree of pain in terms of mild, moderate, severe, very severe, and worse. So a lot of times we use this pain scale, okay, 0 to 10. 0, no pain. 10 is the worst pain possible. So we can ask patients, what is the degree of pain that you're experiencing? Okay, you can use 0 to 10 or 1 to 10 kasi may pain. Then, or you can just ask them, is it mild, moderate, severe, very severe, or worst pain possible? Physical pain can also be categorized as localized or generalized. Localized means it exists in one area or one part of the body, isang lugar lang. Generalized means that it exists in all areas in one region, let's say sa buong abdomen, buong chest, no, that's one region, or in all parts of the body, buong katawan. So it's considered as generalized. Again, physical pain can be categorized as radiating or referred pain. With radiating pain, the pain travels from one part of the body to another. That's why it's called radiating. So the pain literally moves through the body from one part to another. With referred pain, the source of the pain does not move or get larger. The pain is simply felt in another area. Okay. So example, chest pain radiating to the shoulder or neck. Okay. So this is radiation, and it could signify a heart attack. And then in gallbladder inflammation, sometimes you have shoulder pain, malayo yung shoulder sa gallbladder. No? So when you have that, it's called a referred pain. Pain can also be categorized in terms of location, headache, neck pain, chest pain, abdominal pain, back pain, extremity pain, meaning extremity means the arms, the hands, the legs, the thigh, etc. Pain may be categorized as to the cause, whether known or not, and if known, what is the specific cause. Non-specific pain will be those pain whose cause is not obvious at the moment and cannot be identified right away. So you call that non-specific. But if you can identify the specific cause, you call them, it's a type of pain with specific cause. So example of non-specific pain, you can have low back pain, hindi mo alam kung anong dahilan, bakit masakit ang likod, now you call that non-specific pain. Also, if you cannot identify the specific cause of abdominal pain, you can call it non-specific abdominal pain. So you can also have non-specific neck pain and extremity pain. So again, when you said non-specific, the cause of the pain cannot be identified at the moment, okay? Or it may be something that is transient. Okay? Specific pain will be those pains secondary to a specific cause. Example, if you have pain in the abdomen that is caused by acute appendicitis, that is a specific pain. Pain caused by trauma, and then pain caused by an infection. So, as I said, spontaneous, the pain can also be spontaneous and non-specific. When you, since spontaneous pain, sandali lang kasi spontaneous pain, which occurs without apparent cause and it's also sudden, transient, and short-lived, it is usually considered as non-specific pain because it's hard to determine the exact cause. In so short a period of time, you have no chance to observe it, okay? And the pain usually resolves right away, okay? So all of us have experienced spontaneous, non-specific pain. Sandali lang, nawawala, you cannot really explain what it is. So we call that non-specific. So as I said, spontaneous pain means occurring without apparent external cause or trigger. And it's usually sudden, transient, and short-lived. Non-specific pain will be those pain whose cause is not obvious at the moment and cannot be identified right away. They usually disappears by itself. So all of us have to take note of that. because this is not commonly explained to us by our physicians. They always look for the cause of the pain, but there's such thing as non-specific spontaneous pain. You just observe and then it will just disappear. Principle number 1 in the fundamentals and generalities in the management of pain will be, this is the most basic, the most important. So the first step is really to make a diagnosis. Kung ano yung pain na yon, kung ano yung cause ng pain. Then, after the diagnosis, you go to treatment. Then after that, you observe for the outcome of the treatment, whatever it is, and then act accordingly thereafter. Kung nawawala yung pain, well and good. Kung hindi, you may have to reconsider your treatment plan. So, as I said, the first step is diagnosis. So you ask the question, is it physical or mental? Or even a psychogenic pain? So iba kasi yung gamutan ng physical, iba ang gamutan sa mental and psychogenic pain. So if more or most likely you're dealing with a physical pain, which is the sensory pain, you ask this question, what is the diagnosis based on specific cause? If you can name the disease or the medical condition, mas maganda. Or if you cannot, you just consider, is it a non-specific pain? And then you also ask the question, what is the intensity or severity of the pain? Whether it's mild, moderate, severe, very severe, or worse pain ever. Okay. So some assist that you can get in the diagnosis, to get to a diagnosis will be, so you look at the location of the pain, kung nasaan, headache, sa head, headache, body, sa abdomen, abdominal pain, etc. Then whether it is localized or not, and then is it nociceptive? If it's nociceptive, is it somatic or visceral? If it's neuropathic, whether it's sensory, motor, autonomic. Then is it acute or chronic pain? Is it a spontaneous pain? Okay, and other issues other factors that you have to consider. So the first step is really diagnosis. It's an important thing to do because it will determine what to do next. So after the diagnosis comes the treatment. This is principle number 3. Treatment is based on the diagnosis, which includes severity or intensity. If the cause of the pain is a surgical disease, so your diagnosis is that the pain is caused by a surgical disease, one that needs an operation, then the treatment is an operation or surgery. So example, a right lower quadrant abdominal pain being caused by an acute appendicitis, in which the physician thinks the best treatment is an operation, then the treatment for the pain caused by the acute appendicitis is an operation. Okay. Of course, you can give some anti-pain medications initially, but in the end, you have to remove the appendix so that the pain will totally disappear. So as I said, there will be also administration of pain medications after the operation, because after an operation, there is pain, so you have to give medications for the operative pain. If the cause of the pain is non-surgical this time, okay, kanina surgical, then the treatment is non-surgical. Okay. Just medications or supportive management. Example, a strain sa paa, an ankle causing pain that can be treated with ice and warm compress, analgesics, rehabilitation therapy, etc. So if it's a strain only, you don't need to have an operation, and then you just use this conservative treatment. A lot of times it will just disappear. Severity of the pain will influence the type of painkillers or analgesics to be given. For severe pain, usually this requires parenteral, means yung mga IV or intramuscular, ini-inject, no? Okay. Or intravenous painkillers or stronger oral painkillers. Kung masakit na masakit, you need a strong oral painkillers. Moderate pain usually requires strong painkillers also. Mild tolerable pain may not require painkillers, just supportive management or mild painkillers. So not all pain would have to be treated with medication. It can be treated with supportive management. Or if it's tolerable, you just let it be, wait and see, and then just observe, because sometimes the pain will just disappear by itself. But if it's not tolerable, even though it's mild, you can take the mild painkillers. The use of the oral analgesic medications for pains, okay. So the severity of the pain will influence the type of oral painkillers to be given. So some oral analgesics are mild, some are strong. Okay. So examples would be paracetamol, it's the mildest. NSAID means non-steroid anti-inflammatory drugs. Okay. So examples would be ibuprofen, diclofenac, celecoxib, aspirin. There are a lot. Okay. And then the other category is the strongest, the so-called opioid or narcotic drugs. Example will be tramadol and morphine. Okay. So the analgesic drugs can range from mild to strong analgesics. So usually when we try to choose which one to use, okay, there are a lot of medications that you can choose from. So we use the benefit, risk, cost, availability comparison, and then we analyze and then try to select the best options in terms of cost effectiveness. Now, the issue on the use of oral and topical analgesic medications for pain, may mga pinapahid, diba? So it is said that the oral and topical analgesics may be equally effective, especially the so-called NSAID topical ointment. Okay. Oral topical analgesics are used only in pain areas with intact skin. If there's a break in the skin, there's a wound, you don't use the topical analgesics. So advantage of oral analgesics, convenience to use. The risk of oral analgesics, usually kasi iniinom yan, so you can have gastrointestinal symptoms as side effects. And then topical analgesics may be used in patients who cannot use oral analgesics. That's another option. Okay. Again, which one to use, oral or topical? You use the benefit, risk, cost, availability comparison. Another issue, whether to use warm or cold compress for pain. So we know that both can reduce the pain. They can be alternated one after the other. Okay. So cold compress, the mechanism of action, it usually decreases the blood flow, and the warm compress usually increases it. Okay. And both can reduce the pain. For acute pain, the advice is usually to use cold compress first because you want to reduce the swelling and the pain for 24 hours, and then warm compress to reduce the pain, the remaining pain. So you can alternate it with 15 to 20 minutes. Okay. 15, 20 minutes of cold compress, and then for 24 hours. And then after that, you can apply your warm compress 15 to 20 minutes per applications. The difference between analgesia and anesthesia. Okay. You've been hearing the word anesthesia also. So analgesia is the pain relief without loss of consciousness and without total loss of feeling or movement. Okay. Whereas anesthesia is pain relief with loss of physical sensation, such as touch, pain, temperature, etc., with or without loss of consciousness. And anesthesia can be local, regional, and general. When you put a person under general anesthesia, there is a loss of consciousness, usually. Regional, well, usually there's no loss of consciousness. Local, no loss of consciousness, but there could be some numbness or loss of feeling of sensation in the, let's say, regional, spinal. You have loss of sensation in the lower extremities. Okay. So when you put local anesthesia, you can have loss of sensation on the area where it is applied. As to another aspect of pain management will be the cancer pain management. Usually the This is being proposed by WHO or World Health Organization. So the scheme here will be in terms of pain severity. And then step one is to use the mild one, okay, non-opioid analgesics with adjuvant therapy. And then for the more pain, if there's more pain, then you can use the opioid analgesic, but use the weak one, okay? Or you can add another non-opioid analgesics, depending. You have to titrate it. Now, for the most severe pain, it's advised that we give the the strongest opioid analgesics, but we can also add the non-opioid analgesics and adjuvant therapy. So if you look at that diagram, it's a sort of a stairway or step ladder approach. Okay. So in order of strength, we start with the weakest. So these are the following. Non-opioid painkillers such as paracetamol and NSAID. And then mild opioids, example will be the tramadol. And then strong opioids, the morphines. And usually it's given round the clock already, especially for patients in the terminal stage of cancer. Because of the pain, we give it round the clock, okay, because we don't like the patient to suffer. Again, take note of the use of the benefit risk cost availability comparison and the selection of the different options. When you say adjuvant therapy analgesics, it's here in the WHO guidelines. Adjuvant analgesics are drugs which are not primarily used as analgesics, but can produce analgesia in certain types of pain. So it can be administered together with the non-opioid and opioid analgesics in each step of the WHO analgesic ladder. You can see adjuvant therapy, adjuvant therapy, adjuvant therapy. It can be added, okay, plus or minus. So examples of adjuvant therapy will be antidepressant drugs, because a lot of patients might have psychogenic pain already, or because of the knowledge that they have cancer, they're depressed. Okay. So the depression can aggravate the pain. So we give the antidepressant drugs. Now for bone metastases, now we know that the biphosphonate does not cure the cancer, does not resolve the cancer, but we give it to decrease the pain on the bone. The use of morphine, a word about morphine. So there's a common misconception on the use of morphine. So a lot of people are afraid to have morphine because they thought it can cause addiction, because morphine is a narcotic drug. Okay. So from experience, it usually does not cause, it's rare. Now it's rare to cause addiction. And then the other misconception is that it can hasten death. Mas mabilis mamatay yung pasyente. No, as long as the morphine is administered properly, usually start with the low dose and then increasing it until the pain disappears. Okay, so the advice is to use it freely as indicated, and then we don't allow suffering of the cancer patients. So some of the side effects of morphines will be mild sedation and nausea, but these are usually temporary and can be controlled. However, the most common complication or side effects of morphine is the constipation. Okay. So we need to manage this constipation. The other topic that I would like to dwell on in terms of pain, commonly seen in life, okay, is the so-called functional dyspepsia. So yung sakit sa sikmura. Okay. This is a term for recurring signs and symptoms of indigestion that have no obvious cause. Masakit lang sikmura. Okay. Functional dyspepsia is also called non-ulcer. Basta it's not caused by ulcer, it's called functional dyspepsia, non-ulcer stomach pain, or non-ulcer dyspepsia. Functional dyspepsia is common and can be long-lasting, paulit-ulit, although the signs and symptoms are mostly intermittent, paulit-ulit lang. No? So how do you manage functional dyspepsia? I suppose all of us have experienced that already in our lifetime. So during the acute pain, okay, the trick there is just to right away lessen the amount of food intake. Okay. So let your stomach settle down first. Okay. Then, if you have to eat, if you can tolerate feeding, then you use small frequent feeding or especially blunt diet. Then you can take medications if not tolerable or not relieved by dietary changes. Huwag yung gamot kagad. No? A lot of times when you go to physicians, to ER with dyspepsia, they give you medicines right away. Okay, so there's still an option to just try this supportive management. Okay, so if you have to take medications, these are examples of drugs that can be given. So simeticone for the gas reducing, sometimes it's caused by gas. Okay. Antacids, this can still be useful. And then acid reducing H2 blockers, the cimetidine, and then the blocking acid pumps, pantoprazole, and then the antiemetics, metoclopramide. So these are these options available. A lot of times nowadays, when you go to the ER, they give you pantoprazole right away, which is quite expensive. Okay. So you can still try out some of the others, which can be as effective as pantoprazole. Management of functional dyspepsia, let's say as I said, it's intermittent, on and off. Okay, if you want to prevent the recurrence, so you have to make changes to your diet. So eat smaller and more frequent meals, small frequent feeding, that's it. Avoid large meals and overeating. And then avoid skipping meals. Avoid trigger foods such as fatty and spicy foods, carbonated beverages, caffeine, and alcohol. So if you have to take them in moderation. Chew the food slowly and thoroughly. And then, of course, as we know, the other factor that will cause recurrence of the functional dyspepsia is the stress. So try to reduce the stress in daily life. So a lot of times, this functional dyspepsia can be a form of psychogenic pain. The other topic is here, the GERD. You have heard about it, very common. Okay? So GERD is defined as a medical condition where the stomach acid travels upward from the stomach and into the esophagus. So anyone can experience heartburns or acid reflux from time to time. So normal lang yan. However, the GERD is diagnosed when the acid reflux symptoms occur with regular frequency. Palaging andyan, hindi siya nawawala. And you have severe symptoms. Preventive measures for GERD will be weight loss if you are overweight or obese. Then avoid eating meals within 2 to 3 hours of bedtime. Avoid alcohol, tobacco products, and smoking. Avoid trigger foods for GERDs. Okay. Elevate the head of the bed to alleviate the nighttime GERD symptoms. If you have GERD symptoms, try to elevate the head of the bed. Okay. So medications that can be used if it's needed. These are the usual medicines that are being used for GERD. Pantoprazoles, okay, the so-called proton pump inhibitors. Okay. So the action here is decrease the amount of acid in the stomach. The other topic here for type of pain will be abdominal cramps. Usually you experience abdominal cramps when you have gastroenteritis, food poisoning, okay, etc. So one can experience severe abdominal cramps when one has gastroenteritis. Management here will be, again, let your stomach settle, lessen the food intake, or at times fasting for 12 hours, 24 hours, but just take water. If one can tolerate eating, eat a small, blunt diet, small amount of blunt diet at a time. Then you can also apply warm compress to the abdomen. It can relieve the pain if you have cramps. If unrelieved and with severe cramps, you may have to take medications. Usually antispasmodics will be given. Aside from, if you have abdominal cramps, usually you have leg cramps also. This is commonly encountered in life. Okay, so normally leg cramps just last for a few moments, few minutes, few seconds before the muscle loosen up and the pain dissipates. So during the attack, just massage it and stretch it gently and wait, and hopefully and pray that it will disappear soon. So currently, there are no medications specifically designed to treat the recurring muscle pain. Psychogenic pain is another topic, subtopic, another topic to discuss. Okay. So management will be acceptance of the diagnosis of psychogenic pain. So yung ibang pasyente kasi ayaw maniwala it's psychogenic pain. They just refuse to accept that they have some mental disorder, some mental distress causing the pain. Okay, so you have to accept this one. And then after that, you manage the stress and personality that's causing the mental stress, and then have a peace of mind. And then if need be, you may have to seek a psychiatrist. So summary and conclusion and takeaway, I have discussed the following. What is pain? What are the different types of pain? What are the principles, fundamentals, generalities, and the management of the different types of pain? So I just select those which are commonly encountered in life. If I have not explained or some other topics here that are usually seen in life, we can ask them in the open forum. Again, summary, two general types of pain, physical pain and emotional pain or mental pain. So with or without psychogenic pain. So the advice is just manage them accordingly based on the principles and fundamentals and generalities that I gave you above. So the foremost principle will be start with diagnosis and then treatment, and then observe for the outcome of the treatment and act accordingly thereafter. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on pain management. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, kapangyarihan to gain greater control over decisions in the medical management of oneself or your relatives, by knowing the basic principles, fundamentals, and generalities in pain management. So with that, I end my pep talk. I hope I have empowered you to have a better understanding of the fundamentals and generalities in pain management. Before we go to the QA portion, reminder, please take the online learning tool evaluation test exercise. And then 50 OLETE certificates entitled 1 to a free voucher for telemedical consultation. And then another request, reminder, please type in your feedback in the chat box. If you're not going to take the OLETE, or even if you're going to take the OLETE, you're free to make a feedback right now or later on. Then let's now have a picture taking before we go to the QA and interactions. Okay. Ready? Ready? One, two, three. Okay, the floor is now open for questions, comments, and free consultations if you want. Okay. So I hope I have covered the more common ones. Okay. So as I was trying to develop this topic, I really don't, because pain is really a big topic. So I just choose this type of approach to be more practical, just give you some pointers, okay, on the common type of pains that you encounter in life. Okay. And I also encounter in life. Okay. The moment I don't have, I have leg cramps every now and then. Okay. So I apply what I learn and also my own personal experience into the lecture. Other topics will be GERD. I don't have GERD, but I heard a lot of people complaining of GERD, so I include that in the discussion. Okay. And then the different types of pain. No? Medyo magulo lang, no? Medyo malawak lang different types of pain, but this has not been discussed adequately or hindi siya medyo intensive to the point that mahirap intindihin. No? So I try to simplify it. No? So any questions? Choose one type of pain that you have experienced before. I suppose na-experience yung lahat o most of them. Any questions?
There's nothing at the chat box.
How many have experienced abdominal cramps? Meron na sigurado lahat, no? Nakakain ng masama. And then, sumuka, masakit ang tiyan. Ang hirap, ang sakit, sakit, di ba? So, a lot of times you just have to wait and then let the pain disappear. Sometimes you may have to take medications. Okay. So anyone who would like to share their pain experience in the past?
There is one from Jocelyn P. Is it okay to take Pantol? Wait. Is it okay to take Panto Plus long term? My sis and I both have unexplainable stomach pain. We have both been checked and tested, CT scan, gastroscopy, colonoscopy, etc. Nothing serious was seen. Question is, my sis even lost weight.
Your sister lost weight?
Doc. Yes, Doc.
Well, number one, normal lahat eh. So why do you have to take pantoprazole? No? Kung normal lahat, no, you have the benefit of the examination already. So you don't need to take the pantoprazole. No?
Madalas po masakit ang tiyan.
Kaya nga, baka chronic dyspepsia nga yun. No? You just have to change your lifestyle. No? Okay. And then it's not good to take it for a long time. No? May mga side effects din yan eh. Okay. So now that you have have yourself examined, nothing particularly wrong. So you can just adjust your lifestyle, no? Okay. So that you can avoid taking it, no, the medicine. No? Okay.
Thank you, Doc.
I hope it's not psychogenic.
Me too.
Kasi minsan marami kang stress at then you now experience the pain. Baka worry because you heard somebody has stomach cancer, di ba? So you now start experiencing abdominal pain. No? Okay. So thank you for that question. Thank you for that question. That's an application of what I lectured this afternoon. Okay. So any more questions?
You.
I hope nobody experienced cancer pain here. Or kung meron man, what's your experience with your other relatives? You can share it here.
Doctor, how long does a pain, in every pain, gaano mo siya katagal dapat i-treat? Is it 3 days or long or what? Depends on what you feel or what pain you're feeling.
Okay, number one, again, it depends on your diagnosis first. Okay, always starts with the diagnosis. If it's something that you expect na it will disappear in due time, in a short period of time, then you don't have to treat it. No? If it's very severe, you can treat it for a while, but not too long unnecessarily. No? So it all depends. It all depends on the type of sickness or medical condition that you have. No?
Okay.
So diagnosis talaga muna ang importante. No? Okay.
What about I'm having pain pero hindi naman throbbing pain, hindi naman ganong kasakit, but you usually feel it any time of the day to my upper
Right.
upper quadrant. Is it
Ng
because of here?
abdomen, sa tiyan.
Yeah. Is it because of my gallstone or what?
If you have gallstones, pwede. Palaging sumasakit pag kumakain ka ng oily foods.
No naman, but you can really feel like now I'm feeling it, pero hindi naman ganun kasakit. When I push it, pag tinanggal ko yung fingers ko, pabalik, wala naman siyang sumasamang pain. But you see, you can feel that there is a pain in there.
Pag dinidiin lang.
Come again?
Pag dinidiin lang. Pag
No.
dinidiin.
When pag wala akong ginagawa, I can still feel it. So what I did is to push it para pag nirelease ko kung may kasamang pain, wala naman siya. Pero hindi naman bothersome, but I can really feel it every day.
Mhm. Okay. So ang ultrasound mo is stones lang.
Yeah, cholecystiasis.
Okay.
And it's been there for about 5 years now.
Usually pag it's caused by the gallbladder stones, usually masakit na masakit yan eh. No? And then usually pag may cholecystitis, pag dinidiin mo, masakit din yon. No? So that's an indication that's due to the gallstones. No? So I said, yung mga pain na yun, pwede non-specific. You cannot really identify. No? So nagkaroon ka ng ultrasound na-investigate na, no? So yun lang nakita, no? So I guess, okay, the other thing, an important aid in the diagnosis will be, pag tulog ka ba, sumasakit?
No.
Ayun, okay. Usually gising ka, no?
Yes, yes.
So somehow you call that psychogenic also kasi because of yung brain mo maandar during daytime, di ba? So pag tulog ka, hindi mo naiisip yung ano mo, kaya nawawala, di ba? So you just observe na lang. It may I don't know what will be the approach. Nag-positive thinking ka na lang, nasabi mo, ay walang problema ito. Baka mawala pa yan. Na? Okay.
That's why I'm pushing it deeper. So pag ni-release ko, hindi isip ko, pag may kasamang pain, there is something wrong. Pero hindi naman. So when I press it down, pag ni-release ko, wala naman siya.
Okay. Yeah, you can, if you have some pain there, gumawa ka ng maneuver talaga. Tama yun. Maneuver, tingnan mo kung yung gallbladder mo or baka yung liver mo may sakit, di ba? There's something wrong there. Baka enlarged yung liver mo, ganon, di ba? So, kung wala naman, no? At kung infrequent naman yan, every day?
No, not really every day, but you can feel it sometimes.
Okay.
Maybe positional or when I do yoga or exercise after that.
Okay. So, pwede ding positional, pwede ano, no? Okay. So, you just observe lang.
Okay.
Okay. Then you don't have to take the medications.
No. I'm not taking any medication as you advise it not to take anything.
Yeah. Hindi kailangan, wag. No? Okay.
Okay. There is another one from Rochelle de la Cruz. Doc, how is sciatica diagnosed? Possible treatment? Sciatica.
Sciatica is there's a sciatic nerve, no, on the back of the thigh, no. So it all depends on the causes. Kung minsan, or how it is diagnosed. Okay, yung may pain ka doon at the back of your thigh, no, sa likod, andun yung nerve, no. So if you have pain na localized in that back of the pain, yung distribution ng nerve kung saan pupunta, then you can suspect sciatica, no? Okay. And then if you want to be more definite about it, then you have to do some nerve examination, no? Examination of that nerve, no? Okay, yung tinatawag doon. EMG, pwedeng EMG, no? Electro something, no? Parang yung examination of the nerve dito sa carpal tunnel, no? Median nerve. Okay. So you can have some examinations. Possible treatment, it depends on the cause. Kung dahil sa compression, then you may have to relieve the compression. Kung hindi naman wala namang surgical cause, when you say surgical cause, something that has to be treated with surgery, then you can just do some exercise na to relieve that pain. Na kung talagang masakit na masakit, at the moment, you can take some medications to relieve the pain. Na? Okay. But don't rely to, basta yung tanggalin mo yung surgical options. But yung kailangan gamutin na with surgery, kung natanggal na yon, so non-surgical, so you just do some exercise, and then every now and then, if it's not tolerable, masakit na masakit, you take some medications, but not too late to learn. No? Okay, you rely more on the exercise. No? Okay. Any more? Yeah. Wala na?
There is nothing at the chat box.
Hello, Doc.
Aida.
Apo. Ano daw po pag nagkakaedad ka, naiiba yung pain tolerance?
Tama. Pero,
laging na, nagkakaedad ka na. Kasi po, halimbawa, yung pain mo noong bata ka, iba ngayon. Kasi lalo pag hypertensive ka, sabi huwag kang magtiis ng sakit. Kasi nga po, tumataas yung blood pressure. So, yung relasyon ng pain sa blood pressure po. And then another thing po, second po, yung acid reflux, dumadalas po sa nagkakaedad. Medyo nakaka-nervyos. Kasi po, may heartburn minsan. Kala mo sa puso. And then, pangatlo po, sa nagkakaedad din, minsan ang dami na nababasa sa YouTube, sa Facebook. Pag may tumigas doon sa daliri ng paa, yung sabi nila indication na something may problem ka na sa heart o sa mataas ang cholesterol. Yun po, Doc.
matigas sa paa. Matigas sa paa.
Yung naninigas po yung mga daliri. Talaga po para ka napupulikat. Pero yung mga daliri sa paa, medyo nakaka-nervous po. Kasi nga, baka ano yung mangyari. Iba pa po yung pulikat sa binti.
Yung pulikat can occur anywhere, but mostly nasa paa. Nasa may, usually sa yung calf mo, yung sa legs, no? Kumisa, meron din sa toe.
Sa toe po.
Ako, every now and then, yeah, baka due to the medications also that you're taking, no? There's may mga side effects in yung mga, for the anti-hypertension, no? Okay. So, me, I'm taking anti-hypertension. Okay. So, may edad na rin ako. Okay. So, I'm taking anti-hypertension, no? So, for the past 2 years, 3 years, palagi ako nagka-cramps, no, sa umaga. But that's why I said in my lecture, there's no medications because I try to research kung ano yung cause, no? Kung minsan nawawala, kung minsan nandyan, kung minsan exercise ko na lang before I sleep, no? Okay, yung paa ko, no? So, nawawala ako minsan, pero bumabalik ko minsan. But for the past 3 or 4 years,
minsan nakaka-nervous, do, pag midnight. Habang natutulog ka, magigising ka.
nervous o nasasaktan ka. Nasasaktan ka. Masakit na masakit yan, di ba? Okay. But
dagdag na tuloy yung nervyos.
Yeah. Kung nadagdag yung nervyos, pero kusang mawawala siya. Yan ang
nawawala.
Nawawala
siya. Pag yung kung tinataas, nalagyan ng unan, and then i-elevate yung paa.
Yeah. Sa akin, it all depends on yours, gumawa ka ng mga maneuvers which you think would be effective.
Yeah.
Yung sa akin, pag dumarating cramps, tumatayo ako, and then itatapak ko lang. No?
Mhm.
So after a few seconds, nawawala. No? Okay.
Dok, yung ba position ng paa is ready forward sa iyo o dapat ilayo mo? Iba yung sinasabi ng iba.
Iba.
May dapat palayo
Iba
yung
nga eh.
paa o papalapit.
Yung sa akin, tinatapakan ko. Stand up.
Mhm.
Tinatapakan ko. No? And then nilalakad ko ng konti. No? Tapos mawawala. No?
Ah.
So, iba-iba. Iba-iba kasi, that's why I have testing mo na lang. No? Kung which one will be effective in your case. No? Okay. So iba
And then,
naman, ang sinasabi nila, because of the sudden change in position, no? Kasi habang natutulog ka, hindi mo masyadong nagagalaw yung paa mo, then suddenly nag-change kang position, ang sakit, no? Ganon, no? So, maraming theories, but up to now, I cannot really find a solution there. So, parang wag mo nang ipasok yung anxiety, yung takot. Because you know that because it's something that probably it will, although we don't know the exact cause, it will not kill you. It will not kill you. No? Okay. So, dyan lang palagi. No? Okay. So, it's true that pag tumatanda na, depende sa outlook in life mo eh. No? Kung tumatanda ka na, there's a tendency for people to be over anxious about everything na. Okay. Baka malapit na mamatay, ganon, iniisip na yon, no? Compared to younger people, no? Iba yung priority, no? Hindi iniisip yung health nila, ganon. So maraming factors, no? And then not because that you're getting older that you have more pain, no? Okay. But it's true that when you're getting older, mas mataas na ang mga chances na magkakasakit ka. But yung mga sakit, we don't know kung anong tatama sa iyo, di ba? We really don't know. No? So just hope for the best, di ba?
Yes po, Doc. Thank you po, Doc.
Thank you for sharing also. Okay. Any more question?
There is one, Doc. How do we manage? This is from Melly, from Melingo. How do we manage neurogenic pain like trigger finger, numbness, tingling of the fingers? Can we apply cold and warm compress alternate or need physical therapy?
Trigger finger. Iwalay natin yung trigger finger. Trigger finger, yung numbness kasi iba yung numbness.
Trigger finger, yung parang nag-fold siya, Doc, tapos hindi na siya babalik, hindi na siya
what I'm saying is, hiwalay natin yung, to answer your question. Hiwalay natin. Yung trigger finger, you can just, parang stiffness of your tendon lang yan eh. So, exercise mo lang. No? Okay. So, when you say physical therapy, you mean that you have to go to the physical rehab center? Gano'n?
Yes.
You can do it yourself naman. Lagay mo lang, parang home remedy, no? Ikaw lang gumawa, no? Para hindi ka nang gumastos. Yes. You know? Wala rin yan. I got trigger fingers some years ago. Ginagawa ko lang, in-exercise ko, no? Nawawala naman, no? Of course, every now and then, bumabalik, no? Pero bihira na kasi in-exercise ko, no? Okay. Yung numbness, tingling sensation, it depends on the cause, no? Okay. So, most of the time, it's non-specific. Although, laking mga advertisement ngayon, di ba? Yung mga nerve na I won't mention the name, no? Basta kung meron kang tingling sensation, inom ka nitong gamot, no? Yung mga vitamin B complex.
Yes, okay. B1, B6, B12.
Yeah. Sa akin, I've tried it before. It's not really that effective. No? So just let it be, no? Parang exercise pa rin. Exercise pa rin, no? Okay.
Oo.
Move your ano. So, every now and then, babalik, no? Pero it's not, hindi naman nag-progress eh, no? Kahit na uminom ka ng vitamin B complex, babalik pa rin yan eh, no? Hindi ka, kasi you don't really, yung underlying cause na yun, kung minsan hindi natin alam, no? If it's the numbness, tingling sensations due to diabetes, then you treat the diabetes, not the numbness, di ba? If it's due to a carpal tunnel, yung naiipit, no? Yung sa kamay, naiipit yung median nerve, no? Then, ako, ina-exercise ko lang yun. I have carpal tunnel, exercise ko lang, no? So sometimes, people would go for surgery, di ba? Operahan.
Oh.
Sometimes, ini-inject nila yung ng steroids, no? Ganun. So, iba-iba yung options, but ako, try to be conservative muna through exercise, no? As long as it's not progressing, okay lang, no? You just live with it na lang muna. Okay?
In follow-up to Melly's question, that is something that it has something to do with the food that we take or the food that we eat. The numbness, the tingling sensation, whatsoever.
Posible. Posible. Yung numbness, tingling, or gusto mo sama yung pain.
Yeah.
Pain. Okay, just to tell you my experience, the other 2 days ago, kumain lang ako maraming tofu. Biglang sumakit itong kamay ko, itong daliri ko. Ang sakit-sakit, I cannot move it. No? So to the point that I just take, kasi I cannot wash dishes for my wife, so I just said, inom na lang ako ng isang mefenamic. So after taking 1 tablet of mefenamic at 2 o'clock, yun, the rest of the night, the day, wala na. Wala. Kusang nawala. So, but I always attribute it to when I eat some tofu, sumasakit talaga itong daliri ko. This one, just this one. No? Okay. I don't think it's due to gout, but due to the food that you eat. No? Okay. May mga substance doon. No? So yung numbness, tingling sensation, theoretically pwede. No? It can cause, some food can cause numbness and tingling sensation. No? Kasi minsan when you eat some foods, you can also have yung mga allergy, di ba? So allergy can cause those numbness. No? So it's hard to identify. I don't know which foods are causing those numbness. You just have to just test it na lang. Just be vigilant kung ano yung mga observe mo lang kung ano yung foods that will be causing problems to you, iwasan mo na lang. No?
Okay, I think this is a follow-up question from Jocelyn T. Can vitamin B12 help lessen finger numbness and tingling?
Jocelyn, i-research nga natin. For sa akin personally, I've taken vitamin 12, B1, 6, and 12. No, walang effect sa akin. No, okay. So, but I know in the medical world, then yung mga pharmaceuticals, they are promoting that, di ba? So, both the vitamin B,
Neurobion.
B2, B6,
Neurobion.
okay. So, sige. I promise you, I will go in depth to that.
I have tried researching too, Doc. Parang no effect.
No effect, no? Pero,
Parang no effect.
paano mo kakalabanin yung mga advertisement?
Uh,
Ang lakas ng advertisement, di ba?
yes.
Okay.
Thank you.
Sige. Okay. So it's wala na, no more questions.
No more questions.
So we'd like to welcome Clarence. Clarence, can you show your face? We have a new attendees today. Clarence. Clarence.
Yes, Doc.
Welcome.
Hi.
Welcome.
Thank you.
Okay lang? Marami kang natuto? Marami?
Marami po ako natutunan sa tungkol sa pain.
Okay. So,
A-attend lagi, Doc. Pag may
very good. Very
pag,
good.
pag walang
Very
lakad.
good. Sige.
Thank
Emily.
you.
Emily Alba, kumusta na? Nakatulong ba yung lecture ko, Emily? Unmute. Unmute.
Yes, Doc. Ano naman, minsan meron pa ring numbness sa kamay. Pero ganun po, ini-exercise, nakakatulong siya. Usually pag nagbabike ako siguro dahil same position na matagal, so kaya po namamanhid. Tapos pagka ibababa ko naman, magre-rest, nawawala naman po siya.
Yeah, okay. Tama yun. Just remember, sabi nga ni Aida, tumatanda na tayo.
Saka yung pag natutulog, siguro po nadadaganan.
Yeah.
Pag nadadaganan yun, nararamdaman ko rin na. Pero yung sa paa, yung gaya dati, wala na ngayon. Hindi na po namamanhid.
Yeah, okay. So just remember, yung diagnosis, importante yun, non-specific or may specific cause. Pag may specific cause, then you start treating it. Diba? You try to identify treating it. Kung non-specific cause, you identify yung mga factors, mga positions, yung mga environmental factors that can trigger it, na? And then avoid it, na? Avoid it, na?
Okay.
But always have the thinking that it may recur. Ganun talaga ang buhay. It may recur kasi minsan nakakalimutan natin. Now we try, alam natin this position will cause some discomfort pero nakakalimutan natin, gagawin pa rin natin. Diba? So, okay lang yan as long as it's not progressing. It's not causing a disease itself. Then it's not debilitating. Di ka nahihirapan.
Opo.
Okay. So ganun lang, positive attitude at kuminsan naman, kuminsan pag marami kang if you don't introduce the non-specific cause, no? So gagawa kayong maraming test, no? Di ba? Usually pinapagawa kayong maraming test like MRI, kanang gagastos lang kayo, di ba? And then kung isa pupunta lang kayo sa rehab, no? Ganun din, di ba? So pabalik-balik lang 'yon, no? So try to have the understanding of the basic muna, and then try observation muna, no? Okay, observation muna. At kasi most of the time non-specific lang yan no? Okay. Hindi na siya nagpo-progress, no? And a lot of times it will just disappear by itself, pero we know that it will come back sometimes, no? Okay. So as long as it's not progressing, just let it be, no? Okay, hold on. Okay. Okay. So it's 3:22. If there are no more questions, we'll call it a day. So ang topic next week, ano ba yung topic next week? I might be talking on urinary tract infection, which is a common condition among women, no? Kasi marami kayo dito, mga babae, no? Okay, urinary tract infection, no? Okay. Mga basics din, no? Okay. Okay?
Thank you, Doc.
Thank you, Doc. Thank you
Bye-bye.
po.
Bye-bye.
Thank you, Doc.
Bye.
Thank you so much, Doc.
Thank you.
Bye-bye.
Thank you, Doc.